Hello students, Instructor Pamela here. I would like to give an overview of coding, some basic tips to remember and follow as you continue to learn the coding systems and implement them at your jobs. First thing you want to ask yourself is, who am I working for? What facility? What department? What unit? Because that's going to determine what diagnosis codes that you will be choosing, as well as the service codes or surgery codes if is rendered. For example, inpatient coding is driven by the diagnoses, your present on admissions, your POA indicators, the DRGs, the diagnosis related groups, MSDRGs, which is Medicare diagnosis related groups. And these are how the system is basically going to be reimbursed for certain procedures or services. For example, if the patient comes in with pneumonia and the symptoms are coughing, shortness of breath, throat soreness, the patient doesn't know they have pneumonia. So when they're admitted into the hospital, we're going to list the symptoms until we know the definite results that the patient actually has pneumonia. And this will be documented on the discharge summary for inpatient coding. So also keep in mind for inpatient coding that there does not have to have a surgery. Not all inpatient stays need surgery. However, they do need to be treated for whatever symptoms the patient is having or whatever disease or condition they may have. For example, if the patient comes in for hypertension, they need to be treated for the hypertension with the appropriate medications. So those services are actually what we call soft billing or charging, where the system automatically bills for the administration of the medication. Does the inpatient coder code that or capture those charges? No. The only thing you code or capture is the actual hypertension diagnoses, which should be listed as the first diagnoses in the discharge summary, which then will populate or create the DRG, which is the reimbursement amount that the hospital will receive for treating the patient for the hypertension. So that's how your inpatient coding works. And if there is any surgeries performed, it has to match the admitting diagnosis or the first listed discharge diagnosis. Now, for outpatient coding, it is driven by the services, so that includes your CPT codes. So if you are not an inpatient coder, you will probably be using your CPT book often, because all outpatient CMS 1500 claim forms need to have a diagnosis and it needs to have a service or a procedure from the CPT code book. Now your HCPCS book is also part of the CPT coding system, and it basically has your durable medical equipment, your implants such as cataracts, plates and screws for different orthopedic surgeries, administration of the medications, different screening procedures. So again, depending on where you work at is going to depend on which section of the CPT book and the HCPCS book that you'll use. You'll know what code you'll be using when you go to your job because you are applying for the positions. So if you are coding for radiography, you're going to be using the 70,000 codes in your CPT book, and then whatever diagnoses code you have from the ICD-9 book from volumes 2 and 1. Outpatient coding, you always need a diagnosis and a CPT code, and in inpatient, you always need your diagnoses. So I hope this gives you some clarity on inpatient and outpatient coding as far as your basic information and guidelines that you want to follow. And always remember, read your guidelines verbatim because the books are references and they tell you how to code. No memorization. Only thing you should know is your medical terminology, anatomy, and physiology. Until next time, Instructor Pamela here. Journey well.